The decade-long civil war, the Ebola virus disease outbreak, and more recently the mudslide and the catastrophic flooding exposed the fragility of the healthcare provision system in Sierra Leone.
Queen Margaret University is working in partnership with the College of Medicine and Allied Health Sciences in Sierra Leone and the American University of Beirut in Lebanon on a 4-year research project to inform and support the Ministry of Health's agenda in preventing and managing non-communicable disease and mental health in fragile settings.
Due to the shocks as a result of the long civil war and Ebola epidemic, there is evidence that mental health disorders and the psychosocial problems have affected a significant number of Sierra Leoneans.
The prevalence of risk factors associated to non-communicable diseases such as hypertension and diabetes is increasing in Sierra Leone.
NCDs and mental health are some of the areas in which we do not have sufficient data. So if we do not know the number of cases of people with mental disorders or the number of cases of people with diabetes and hypertension, we cannot provide them with adequate medical assistance.
And we really need more data to map the situation and where the needs are, and to better know where to implement the interventions, and also know the effect and the results of the interventions.
So what we have done as a ministry is to prioritize the non-communicable diseases, and of course try to see how we can work with our partners to harmonize our training manual so that we're able to give the same information, the same training to our healthcare providers, so they're able to provide evidence-based services to our beneficiaries.
The NIHR Research Unit on Health and Fragility will work with the NCD and mental health directorates and other key stakeholders in the healthcare system, and we aim to work together to address these neglected and long-term conditions in Sierra Leone.